Problems with entrance screening, cleaning, signage, and staff training. In total, all 21 items assessed in this report by Hamilton Public Health during a January 7th inspection of the for-profit Aberdeen Gardens retirement residence were found not in compliance with infection prevention and control protocols. We immediately rectified 16 of those items and are responding to each remaining item with the appropriate urgency. Aberdeen Gardens has been managing a COVID-19 outbreak since January 2nd. There have been 6 cases and 1 person has died. At the Cardinal Retirement Residence, a for-profit residence where at least 7 people died and there were 65 COVID cases during a months-long outbreak last spring, an inspection just this past Monday found 20 issues, including residents not wearing masks in common areas and improper screening of people coming and going. We have taken all recommendations and direction from Hamilton Public Health extremely seriously and began to make corrections to these areas immediately after our inspection. And at a third for-profit facility, Blackadar Continuing Care Centre, an inspection on January 7th and a follow-up just 2 days ago found issues with physical distancing and active screening of residents. All issues identified in recent reports have been addressed or are in the process of being rectified and worked together with the LHIN, HHS, and Public Health. There have been 9 cases of COVID-19 and 1 person has died since an outbreak was declared January 3rd. The centre is operated by Extended Care Assist, the same company that operates Tender Care Living and Orchard Villa in Toronto, the sites of the 2 deadliest long-term care home outbreaks in the province, with 73 dead at Tender Care and 70 dead at Orchard Villa.
Clearly, it would seem that they're not doing a good job.
Long-term care home researcher Vivian Stamatopoulos says too few staff and improper training is leading to infection prevention and control mistakes at many for-profit seniors facilities across Ontario. She says research shows nonprofit homes have been better able to control COVID-19 outbreaks.
9 times out of 10, the for-profit, often large chain ownership homes that cannot seem to control their outbreak despite, raking in multi-million dollars in profits.
Fellow long-term care home researcher Pat Armstrong says there's a clear pattern where the quality of care is better at nonprofit homes.
So my question is, why do we have for-profit homes, or why do we have for-profit managed? What's their advantage? I have seen no evidence that there's an advantage from them.
Earlier this week, the province's COVID-19 Science Advisory Table predicted that deaths in long-term care homes during this second wave of the pandemic will exceed those during the first wave. Now, just in the last day, another 23 Ontarians have died of COVID-19 in long-term care homes across the province. Since the pandemic began, that number is more than 3,000.